Welcome to this explainer. Okay, today we're diving into the pretty fascinating world of cupping therapy. Whether you're a serious athlete looking for that recovery edge, or honestly just someone trying to soothe some chronic back pain, you have definitely heard of this treatment. But how much of it is just hype and how much is actually grounded in real physiological science? Well, we're going to break down exactly how it works, why it's used, and what is literally happening to your body under those little cups.
You know the ones? You've probably seen these striking, almost perfectly round marks on Olympians, pro athletes, and celebrities. And yeah, they certainly look intense, right? But today, we're going to move past the visual shock value. We want to investigate what is actually happening under your skin. Are those just bruises? Does it hurt? And what is the biological purpose of creating these marks in the first place? Let's unpack the whole mystery.
Here's our quick roadmap for today. We're going to cover the basics of cupping, look at what happens under the suction cup, get the truth about those marks, check out the science and evidence, and wrap things up with safety and smart treatment.
All right, Section 1, the basics of cupping from a mechanical standpoint.
So, at its core, cupping therapy is a traditional treatment that relies on one really simple physical mechanism: suction. Cups, which can be made of glass, plastic, silicone, or even bamboo, are placed right on the skin. But rather than pushing down into the tissue, the way a massage therapist's hands normally would, the suction pulls the skin and that superficial muscle layer upward into the cup. Think of it literally like a reverse massage. Instead of compressing your muscles, the suction is lifting and separating the tissue, gently stretching the fascia, that tight web of connective tissue that surrounds all your muscles.
So why on earth do people do this? Well, people turn to cupping for a huge variety of musculoskeletal and stress-related issues. The most common target areas are probably exactly what you'd expect. It's incredibly popular for neck and back pain, general muscle tightness, and speeding up sports recovery. But people also swear by it for shoulder pain, chronic headaches, and honestly, just general relaxation. In some cases, practitioners even use something called dynamic cupping. This is where they apply a bit of lubricant to your skin and actually glide the suction cup across your muscles to get things moving.
Moving right along to Section 2, under the suction cup. Let's look at the actual mechanics and effects.
Basically, there are two main methods used globally: dry cupping and wet cupping. Dry cupping is by far the most common method you're going to encounter in a typical physical therapy clinic. It uses either a quick flash of heat or a manual hand pump to pull the air out of the cup and create a vacuum, leaving it in place for about 5 to 15 minutes. Wet cupping, on the other hand, which is also known as hijama in traditional systems, is quite different. It involves light suction followed by tiny incisions to actually draw a bit of blood out of the body.
Let's look just a little closer at that wet cupping process, because it happens in 3 very specific steps. First, the practitioner applies an initial light suction to bring blood right to the surface. Second, they take the cup off and make very small superficial incisions on the skin. And third, they reapply the cup, so the suction draws out a small amount of blood. Because wet cupping actually breaks the skin barrier and handles bodily fluids, it is absolutely critical, like non-negotiable, that it's only performed by highly trained practitioners using strict medical-grade hygiene.
Now, there is actually a massive amount of physiological activity happening right underneath that cup. First off, you get increased circulation. The vacuum physically dilates your small blood vessels, rushing fresh oxygen and nutrients to the area. Next, you get muscle and fascia relaxation, because that lifting effect we talked about is stretching out stiff tissue. Then there's pain modulation. Stimulating the nerves in your skin actually kind of tricks your nervous system and kicks off your body's natural pain control mechanisms. It also creates a controlled inflammatory response, which essentially jumpstarts cellular repair. And finally, lymphatic drainage. The upward movement helps shift stagnant fluid, which can really reduce feelings of swelling or heaviness.
All right, Section 3, the truth about marks and visual indicators.
Okay, here's the absolute biggest takeaway you need from this. Those dark circles are not traditional bruises. A normal bruise comes from blunt force trauma that actually damages your tissue. The marks from cupping? They're simply the result of vacuum pressure. The suction pulls so intensely that tiny blood vessels, called capillaries, safely break just beneath the surface of your skin. Blood and fluid temporarily pool in that specific circular area. So while they look super intense and painful, they honestly usually aren't, and the marks will naturally fade away completely within about 3 to 10 days as your body just reabsorbs the fluids.
Let's jump to Section 4, Science, Evidence, and Application. Let's look at the actual data.
So, keeping an entirely objective view here, the clinical data presents a pretty nuanced picture.
Research absolutely shows that cupping can provide very real, short-term pain relief and improved mechanical function, especially for things like chronic back and neck pain. However, we do have to note that the overall quality of this scientific evidence currently ranges from moderate to low. And more importantly, it is definitely not a cure for underlying structural problems. Like if you have a herniated disc, cupping might temporarily relieve the muscle spasms around it for sure, but it is not going to fix the disc itself.
I think this really hits the nail on the head. Cupping is best viewed as a supportive therapy rather than a standalone treatment. That quote perfectly summarizes the modern medical reality of this practice. Its benefits are actually very similar to other manual therapies, like a deep tissue massage or myofascial release. Because of that, it really shouldn't be treated as some magical cure-all. It's a fantastic tool to help manage your symptoms, but it works best when it's supporting other treatments.
And that is exactly why professional physiotherapists use it as just one piece of a much larger puzzle. A smart, holistic recovery plan might involve cupping first, just to calm down your pain receptors and loosen up the fascia. But then a good practitioner will immediately follow that up with stretching, targeted exercise therapy to actually build strength, manual therapy, posture correction so you don't just re-injure yourself tomorrow, and even breathing techniques. This kind of combined approach is vastly more effective for long-term recovery than just relying on cupping alone.
Almost done. Section 5, Safety and Smart Treatment. Let's go over the safety parameters.
Now, generally speaking, cupping is considered super safe when it's done by a trained professional, but you still need to be aware of a few possible side effects. We already covered the temporary skin marks, totally expected. You might also feel some mild soreness, kind of like how you feel after a really tough workout, or maybe some brief dizziness when you stand up because of the sudden changes in blood flow. But there are more serious risks if your practitioner is negligent. We're talking skin irritation or actual burns if the heat method is done sloppily, and, as we discussed, a very real risk of infection if wet cupping is done without adequate hygiene.
And listen, cupping is definitely not for everyone. You absolutely have to sit this one out if you have bleeding disorders or if you're taking blood thinners, since the suction directly affects your vascular system. Obviously, do not place cups over broken or infected skin or if you're having an eczema or psoriasis flare-up. It's also a big no-go for anyone with severe anemia or dangerous conditions like deep vein thrombosis or DVT. And for anyone who is pregnant, cupping over the abdomen or the lower back should be entirely avoided unless you're specifically advised otherwise by a qualified healthcare pro.
So, there you have it. We've broken down the actual mechanics of the suction, demystified those dramatic dark marks, and taken an objective look at the science and the safety rules. Now, it's totally up to you to decide. Knowing that it's a powerful tool for short-term relief, but not a standalone cure, how might it fit into your own health routine? Thanks so much for joining me for this explainer. It really leaves us with a pretty fascinating question. As modern science continues to catch up with traditional therapies, which ancient wellness practice will we validate next?